Nearly 7 months into the pandemic, many long-term care facilities across the state are in the process of reopening for visitors. There's concern about the well-being of residents because of reduced interactions with their loved ones. Amy Wadas explains what's being done to change that.
We don't want her dying alone.
Michelle Algieri is talking about her mom, 85-year-old Marjorie. She lives in Southwestern Skilled Nursing in West Mifflin, but she's coming home to live with her daughter tomorrow.
Loneliness is awful. It can take a life.
Something President and CEO of the Pennsylvania Healthcare Association, an advocacy group for long-term care providers across the state, says needs to be addressed.
We're now seeing the aftermath of what a lack of visitation, interaction, and conversation has done to our most vulnerable residents. But providers have had to take the necessary steps to keep those very same residents safe from COVID-19.
Which Schamberg says was necessary when the pandemic hit in March. But now, as visitation restrictions are slowly starting to ease at long-term care facilities, Schamberg says more needs to be done to help residents battling isolation.
So we have had almost weekly communication with the Department of Health. Back in May, when the guidance was first released, we really did push away from the one-size-fits-all approach, and we asked for a more facility-specific plan.
The Essential Caregiver Bill was introduced by State Senator Bob Mensch. The bill would allow at least one loved one to come into a facility to visit a resident. Right now, the state is allowing facilities to have a compassionate caregiver come in.
That the provider can determine what the right course of action is for that essential caregiver. The compassionate caregiver program doesn't give the provider that opportunity or that responsibility, and it's problematic, especially in the case of an outbreak.
Jennifer Pulse and her father, Robert, know all too well what Michelle Algieri is going through. We interviewed them at the beginning of August, and since then, 91-year-old Rose, who lived at Masonic Village in Sewickley, passed away. They say she wasn't eating and was suffering from loneliness.
It was basically too late.
The timing was
She slipped through the cracks.
Zach Schamberg says the PHCA is constantly pushing for more PPE and priority testing and is continually working with the state to ease visitation restrictions. Amy Wadas, KDKA News.